It's going to be a little bit unpredictable with flu this year, but what we do know is that the last 2 winters in Australia we've had very little flu, and that's a pattern that's been seen around the world. But in the last winter in the Northern Hemisphere just gone, we have seen flu come back in countries like the UK as well as Denmark and other places. And in Australia, with increased international travel, we do expect that flu is going to come back to our shores this coming winter. And it is possible, with a big gap since we had a last flu season, that people will be less immune to the flu, and that might lead to a larger flu season than we've seen in the past. For that reason, it is recommended that all Australians over the age of 6 months get their flu vaccine this year come winter time to protect against flu, where we might be seeing more numbers than we have in the past couple of years. So you might have heard about this BA.2 variant, and really it's a further variant of Omicron, which has developed a couple of extra mutations, and it's started to be picked up in New South Wales and other states around Australia, where back in February accounted for about 10% of cases, and now it's about a quarter, and it's expected that it will overtake the original Omicron variant to be the dominant strain that's circulating in the coming weeks. And this is because it has an advantage over the original Omicron strain, that it's more infectious and it spreads more easily. So that probably means 2 things. There's some bad news, but also some good news. The bad news is that probably with the more rapid spread, there's the possibility that we'll see more cases emerge than if we hadn't seen this variant develop. But the good news is that it doesn't appear to be more severe than the original Omicron strain. And importantly, the tools that we have still work against this new BA.2 variant, and that is masking and social distancing. And vitally, we know that 3 doses of the vaccine is recommended for all adults, and 2 doses for children at this stage provide protection against this new BA.2 variant. So what we do know is that having 3 doses compared with having 2 doses boosts your protection against getting infection with COVID, and also reduces your risk of needing to come to hospital if you do get COVID. But we also know from data that's emerging from other countries, including in the UK, is that this protection does reduce over time, particularly the protection against getting infection, although the protection against ending up in hospital seems to last for longer. And so it's likely that we'll need to consider whether 4th doses might be important, particularly for those who are at highest risk of ending up unwell with COVID. And for example, in the UK, they've recommended booster doses, so a 4th dose for those people aged over 75, along with immunocompromised patients. So in Australia, we may follow a similar pattern initially, and as ATAGI and the other government bodies get more data in, there'll be further decisions made about whether a 4th dose is needed for the general population beyond those high-risk groups.